Hi, it's Christina with the Sisyphean Journal. According to the Centers for Disease Control, there really is no legitimate reason for a woman to bleed to death from a safe, legal abortion. Doctors operating safely and legally have every means at their disposal to detect hemorrhage, to detect the specific cause of the hemorrhage and to treat the hemorrhage. But that doesn't stop them from sending women home to bleed to death. Now, Pamela Colson, age 31, was 12 weeks pregnant when friends drove her to Women's Medical Services in Pensacola, Florida, for a safe legal abortion on Saturday, June 25, 1994. The abortion was performed by Dr. William Philip Keene. Pamela bled heavily during the drive home. According to her friends, she began having trouble bleeding when they were about halfway home to Port St. Joe. She became unresponsive at about 7:30 p.m., so they pulled into the parking lot of Scottish Inn in Panama City. The hotel's manager said that two passers-by performed CPR while Pamela's friends called for an ambulance. Somebody else attempted to wave down traffic to seek additional help. When medics arrived, they found Pamela in full cardiorespiratory arrest. They took over her care and transported her to Bay Medical Center. Surgeons there performed an emergency hysterectomy in a vain attempt to save her life, and she died shortly after midnight the following day. Her autopsy showed blood-stained fluid in her chest and peritoneal space, which is the area around the uterus. Extensive hematoma formation in the pelvic area, which is lots of big globs of clotting blood in the pelvic area, with the peritoneum distended from the left gutter area caudally. So she was so full of blood that her abdomen was distended. So the surgeon who had performed the emergency hysterectomy had removed her uterus at the site of the laceration, so that the laceration formed a portion of the incision to remove the uterus. Her uterus showed extensive hemorrhage and blood clots, and her uterine artery was also injured. Several of her ribs were fractured, apparently in the attempts to resuscitate her, and this is common even in properly performed CPR. The cause of death was given as irreversible shock from blood loss due to a perforated uterus occurring at the time of elective abortion. So there was such a big tear in her uterus that the doctors used that as part of the incision to remove the remainder of her uterus. After the investigation into Pamela's death, Keene was fired from Sarasota Women's Health Center, which is the other Florida clinic where he worked. So kudos to them for getting rid of this guy who would slash a woman's uterus and then send her home to bleed to death, a la Jesse Ketchum. But the director of Women's Medical Services, where the fatal abortion was performed, poo-pooed the idea of dismissing Keene. Of course he's allowed to perform abortions. That's a ridiculous question. Complications occur all the time. Yeah, he's sending them home lacerated all the time, and, most of them are saved. Is that what she's saying? So the clinic director insisted that Pamela seemed fine talking and eating before being discharged from the clinic. It's not uncommon for patients to seem okay before they rapidly decompensate. The director also showed disdain for the press covering Pamela's death, telling the Tampa Bay Times, patients die all the time, whether it's a gallbladder operation or hernia or a tonsillectomy. Nobody cares. It's not front page news. Why is this different? We did everything we were supposed to do. So evidently it was lost on her that the notoriously abortion-friendly Centers for Disease Control had long since stated that there was no legitimate reason for an abortion patient to bleed to death. And I do provide a link. If you follow the link to my blog post, I provide a link to where the CDC said this. David Grimes et al. Clearly said, and I quote, "Deaths from hemorrhage associated with legal induced abortion should not occur. Yet hemorrhage was the third most frequent cause of death from legal abortion in the United States between 1972 and 1979, which is the period that Grimes was studying. 24 women died from hemorrhage after legal abortion in the United States from 1972 to 1979. So Third most frequent cause of death, 24 deaths in that 7-year period just from hemorrhage. Okay? Legalization did not make deaths go away. Deaths from hemorrhage can be eliminated by preventing uterine trauma during abortion and rapidly diagnosing and treating hemorrhage if it occurs. So that's from the CDC. They're very pro-abortion. That's not me saying these guys have no excuse. That's the CDC saying they have no excuse. Pamela's family didn't find out about her death until the following Tuesday because they were traveling at the time. Her parents sued the clinic on behalf of themselves and the 2 motherless children, but the case was dismissed because their attorney failed to submit an investigation in a timely manner. So, 24 women in that period that the CDC is going, there's no excuse for this. And the abortion lobby's like, oh, abortion's perfectly safe. It's so safe. It's so safe. Aren't we glad it's legal? When it's legal, it's safe. Right.